Absolutely. The Zircon study was an open label, multi-center clinical trial that tested a PET imaging tracer called TLX250-CDX in patients who were suspected of having renal masses that were concerning for renal cell carcinoma. The study was a positive trial demonstrating that the imaging agent was well tolerated and could accurately and non-invasively identify clear cell RCC, really opening up the door for this imaging agent as a promising modality in the diagnostics of renal masses. Now, what was done in this analysis was looking at radiation exposure in the context of a patient being administered TLX250-CDX. And on this trial, there was administration of the agent and actually testing the radiation exposure at various distances from the body surface, right at the body surface at 1 and 2 meters from the body surface, and at various time points from the actual infusion, immediately following infusion, 2 hours after, day 3, day 4 before surgery, and day 4 after surgery. And really, I think what the biggest take-home message is that this the radiation exposure in all of these contexts, in all of these time points, was fairly low and associated with low exposure in the operative setting, really demonstrating that this is, a safe agent to be administered in the perioperative, setting. So, with the positive results of the phase 3 trial, and the potential integration of zirconium-girentuximab into clinical practice, certainly appropriate radiation protection procedures are needed, but from this study that was highlighted, it does not appear that, procedures or protocols beyond what is typically done for PET imaging diagnostics need to be implemented in clinical practice. While the Zircon study was a positive trial, this agent is not actually available for clinical utilization at the present time. It has now actually entered into clinical practice. The Zircon study was done in the pre-surgery setting for patients who had renal masses, attempting to identify whether those renal masses represented clear cell RCC. There's certainly great opportunity for utilization of this imaging agent in the post-nephrectomy setting for monitoring patients for risk of recurrence and for local and distant recurrences after surgical resection. Additionally, it would be interesting to see whether there could be imaging markers of response that could be looked at in the PET imaging modality. So I think in the post-operative setting, I think there's a huge unmet need for identifying recurrences post-operatively. That's correct. Yeah. I don't think from this study about radiation exposure with the timing and distance from body and operative exposure that there would need to be new or different radiation practices beyond standard of care for other PET imaging modalities.